Talk about water soluble vitamins. All are cofactor in major biochemical pathway. Vitamin C. Classical example vitamin C deficiency. Older portion on tea and toast diet, indicating that they are malnourished. Patient gets bleeding of the gums, scurvy due to vitamin C deficiency. Vitamin C is responsible for hydroxylation of proline and lysine, and this occurs in the Golgi apparatus because that's where post-translational modification occurs. Patients have a weak type 1 collagen because cannot cross-bridge it. Therefore, therefore, mm, unstable and gums bleed. Get bleeding of the gums inflammation and may lose teeth. So vitamin C deficiency. Older patient children tea and toast diet indicating they are malnourished. Patient gets bleeding in the gums scurvy. So bleeding the gums scurvy due to vitamin C deficiency. Vitamin C responsible hydroxylation of proline lesion. And this occurs in Golgi apparatus because that's where post-translational modification occurs. Patients have a good type 1 collagen because cannot cross-bridge it, therefore are unstable and gum split. Get bleeding of the gums inflammation may lose teeth. Patient with scurvy. Number B, the associated questions. What complication is associated with severe hemophilia A? Is a hematrosis and caused by vitamin C deficiency because unstable and rupture. Blood vessel are unstable and rupture. Collagen Taiwan which is bone, type 2 cartilage, type 3 which is type 4 bone floor. This is a collagen Taiwan, blood vessel unstable. What complicated associated with severe hemophilia A, hematrosis, and cause vitamin C deficiency because blood vessel unstable and they rupture. Physical diagnosis of vitamin C deficiency along with the tea and toast diet. There is also polyfollicular hemorrhage around the hair follicle, C-ring sideroblast, nucleated red blood cell, and have too much iron in the mitochondria. In around the hair follicle also see coxreal hairs. Coxreal hair due to vitamin C deficiency. So the tongue looks like it hurts and patient with vitamin C have a smooth tongue. So glossitis, callosis around ankles, glossomorrhagic diathesis, which is scurvy, skin findings vitamin C deficiency. Look like that. So again, vitamin C deficiency. So classic symbol vitamin C deficiency. Older patient with tea and toast and tea. So which is lack of vitamin C. We call lack of vitamin C, malnutrition, malnourished patient get the bleeding of the gum. Sau con scurvy due to vitamin C deficiency. Vitamin C is responsible for the hydroxylation of proline and lysine. Okay, and this occurs in the Golgi apparatus because that's where post-translational modification occurs. So patients have a good type 1 collagen because cannot cross-bridge it. Therefore, blood vessels are unstable and gum bleed. Get bleeding of the gums, inflammation, and may lose this. So cannot cross-bridge, therefore blood vessels are unstable and gum bleed. Gum bleeding, get bleeding, gum inflammation, or inflammation, and may lose this. So severation, what complication associated with severe hemophilia A, hemarthrosis, and cause vitamin C deficiency because blood vessels are unstable and they rupture. Physical diagnosis vitamin C deficiency along with the T tells that there is they call this a perifollicular hemorrhage. So which is a hemorrhage bleeding around hair follicle. That's also sign of vitamin C deficiency. Ring sideroblast, nucleated red blood cell, and have a too much iron in the mitochondria. Serine sideroblast, nucleated red blood cell, and have a too much iron. Serine sideroblast, nucleated red blood cell, and have a too much iron in mitochondria. Ring around the hair follicle and also see coxal hair due to vitamin C deficiency. The tongue looks like it hurts, and patients with vitamin C have a smooth tongue. Glossitis with callosis around ankles, plus a hemorrhagic diathesis, scurvy. Serine sideroblast, nucleated red cell, and too much iron in mitochondrial ring around the hair follicle. Also see coxal hair due to the tongue looks like hers and patient may see the smooth tongue. Glossitis with callosis around ankles, plus a hemorrhagic diathesis, scurvy. So excess vitamin C very common because patients take away too much vitamin C. Vitamin C excess are also common. For patients take too much vitamin C, 6 to 8 grams. Main complication which is kidney stone, renal stone, increased uric acid stone, and other kinds of stone. Vitamin C and D both have a toxicity stones. So vitamin C is used in ancillary treatment for methhemoglobin it's a reducing agent in the great scavenger hunter for free radical knocks them out. Vitamin C is used in ancillary treatment for methhemoglobin reduce the agent in the great scavenger hunter for free radical knocks them out. Cofactor in biochemical pathway vitamin C is cofactor for converting catecholamine not appearing into epinephrine. Okay. So vitamin C, vitamin C deficiency older patient in tea and toast. So this is a malnourished. So get bleeding of the gum. So because scurvy due to Vitamin C deficiency. Vitamin C we know responsible hydroxylation of proline and lysine. This occurs in Golgi apparatus because where post-translational modification occurs, patients have a weak type 1 collagen because cannot cross-bridge. Therefore, blood vessels are unstable and gum bleeding. When gum get bleeding, they get inflation and easy to lose this. So, what complications associated with severe hemophilia, hematopoiesis, and caused by vitamin C deficiency because the blood vessels are unstable and they rupture. The physical diagnosis vitamin C deficiency, along with the tea and toast diet, there is also perifollicular hemorrhage. The hemorrhage around the hair follicle, see ring sideroblast, mitochondria ring around the hair follicle, and also see Cox real hairs due to vitamin C deficiency. The tongue looks like it hurts, and the patients with the vitamin C have a smooth tongue. The glossitis with callosis around ankles, plus a hemorrhagic diathesis, curvy. So the tongue looks like it hurts, and patients with vitamin C have a smooth tongue. So glossitis with callosis around ankles, plus a hemorrhagic diathesis, curvy. Tongue looks like it hurts, and patients with vitamin C have a smooth tongue. Glossitis with callosis around ankles, diathesis, curvy. So excess vitamin C very common because patients take too much. Vitamin C 6 to 8 gram main complication renal stone, increased uric acid stone and other kinds of stone. I C and D both toxicity stone. Vitamin C usually used in ancillary treatment for methemoglobin this reducing agent and the great scavenger hunter for free radicals. Knocks them off. Cofactor in biochemical pathway. Vitamin C is a cofactor for converting catecholamine norepinephrine into epinephrine. So vitamin B1 thiamine involved in many biochemical reactions, catalase reaction in the pentose phosphation and pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase, and alpha-keto acid dehydrogenase. All of the dehydrogenase reaction requires thiamine as a cofactor. Pyruvate dehydrogenase is the main reaction that converts pyruvate into acetylcoenzyme. Pyruvate can also be converted OII with the carboxylase enzyme when you combine acetylcoenzyme A with OII. So you make citrate and you are in the TCA cycle, cyclic acid cycle. Vitamin 1, B1, involved in many biochemical reaction, transcatolase reaction in pentophosphation, pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase, alpha-keto, alpha-keto acid dehydrogenase. All the dehydrogenase reaction requires thiamine as the cofactor. Pyruvate dehydrogenase is the main reaction that converts pyruvate into acetylcoenzyme A. The pyruvate can also be converted to OAI with the carboxylase enzyme. When you combine acetylcoenzyme A with OAI, you make citrate and you are in TCA cycle. So if thiamine deficiency because it is involved in the pyruvate dehydrogenase reaction, which converts pyruvate to acetylcoenzyme A, you will not have you will not have a lot of acetylcholine around, therefore won't have much citrate around, therefore you won't have a TCA cycle working efficiently and less ATP. Therefore, the problem with thiamine deficiency is ATP depletion. When you go from pyruvate to acetylcholine, you generate 2 NADH, and since this is into mitral, you get 6 ATP. So just from going from pyruvate to acetylcholine give a 6 ATP, and then with the TCA get 24 ATP. 6 plus 24 equals 30 ATP. The total you can get from completely metabolizing glucose is 38 ATP. So if you are thiamine deficiency, you are out 30 ATP. So the main problem of thiamine deficiency is ATP depletion. In thiamine deficiency, you will see foot drop, which is dry beriberi, and pidgin edema, wet beriberi. How does this explain dry or wet beriberi? With dry beriberi, which is peripheral neuropathy, refer to Wernicke's psychosis. Cannot remember old and new things. Like example, so used to know that, but cannot remember now. Memory problem. So it takes a lot of ATP for synthesis of myelin. Without myelin, you will get peripheral neuropathy and foot drop due to common peroneal palsy. Can get wrist stroke, radial nerve palsy, and claw hand ulnar nerve palsy. Wernicke encephalopathy is confusion, ataxia, and nystagmus. Only are due to demyelination. Patient with thiamine deficiency and foot drop, kidney edema as well. Wet periphery, which is heart failure, most common cause thiamine deficiency, alcohol, not polystyrene. Alcoholics are the most common people with thiamine deficiency. Wet periphery is referring to cardiomyopathy cause left heart failure, when into right heart failure, which lead to kidney edema. Heart needs ATP to function. Therefore, the patient will have congestive cardiomyopathy. The heart will have a biventricular enlargement. The whole chest will be hot. Left and right heart failure. Kidney edema is size of heart of right heart failure due to increased hydrostatic pressure behind the failed heart. If you give IV timing, can reverse, and in some cases is related to toxicity to alcohol and cannot work. Example, patient with the ER, patient in ER give IV of 5% dextro and normal saline. All of a sudden, patient develop confusion, nystagmus, ataxia, of thermoplegia, diagnosis subclinical thiamine deficiency. As soon as the glucose was hung up and the pyruvate went to acetylcholine and used the rest of thiamine and went into acute Wernicke's encephalopathy. Therefore, moral of the story, give IV thiamine before ending up IV glucose. Excuse me, especially in ER. When people come in a comatose or semi-comatose, several things you always do. 50% glucose if hypoglycemia problem. Number 2, naloxone. Number 3, IV thiamine. Talk about in thiamine deficiency, you will see foot drop, dry periphery and kidney edema. Wet periphery. Other this is explain dry and wet periphery. So with dry periphery, which is peripheral neuropathy, refer to a psychosis, cannot remember old and new things like resemble. He used to know that, but cannot remember now a memory problem. It takes a lot of ATP for synthesis of myelin. Without myelin, you will get peripheral neuropathy and foot drop due to common peroneal palsy. Can get wrist drop, radial nerve palsy, and claw hand ulnar nerve palsy. Wernicke's encephalopathy is confusion, ataxia, and nystagmus. All of these are due to demyelination. How about the wet periphery heart failure, most common thiamine deficiency? So most common cause thiamine deficiency is alcohol, right? Not polished rice. Alcoholics are the most common people with thiamine deficiency. So wet periphery is referring to cardiomyopathy, cause of left heart failure, went into right heart failure, which leads to kidney edema, heart needs ATP to function. Therefore, the patient would have congestive cardiomyopathy. Their heart will have a biventricular enlargement. The whole chest will be hard. With left and right heart failure, kidney edema is a sign of the right heart failure due to increased hydrostatic pressure behind the failed heart. If you give IV thiamine, can reverse, and in some cases, it's related to toxicity of alcohol and cannot work. So example, patient in ER, IV 5% dextro and normal saline. On a sudden, patient developed confusion, nystagmus, ataxia, and ophthalmalacia. So diagnosis of clinical thiamine deficiency. As soon as the glucose was hung up, the pyruvate went to the extinguisher and used to raise the thiamine. Hung up, the pyruvate went to raise thiamine. Then went into acute encephalopathy. Therefore, moral of the story, give IV thiamine before handing up IV. Give IV thiamine, huh? So before, give the IV glucose, especially in ER. When patients come in comatose or semi-comatose, several things you always do. 50% glucose if hypoglycemia problem. So naloxone overdose, IV thiamine. When people come in comatose or semi-comatose, several things you always do. 50% glucose if hypoglycemia problem. Use naloxone if overdose, shock overdose, and IV thiamine. Or keep in mind IV thiamine. Vitamin B3, niacin, slide, rash in sun exposed area, pellagra, also known as dermatitis, due to niacin deficiency, also diarrhea, dermatitis, dementia, 3D. Niacin deficiency have a 3D, diarrhea, dermatitis, dementia, so hyperpigmentation in sun exposed area. So cancer, necklace, dermatitis, pellagra, hyperpigmentation in sun exposure area. So cancer, necklace, dermatitis, pellagra. So vitamin B deficiency, vitamin B3, 3 niacin, 3 which is 3D, which is that niacin deficiency, niacin which is vitamin B3. So 3D which is diarrhea, dermatitis, and dementia. Rash in sun exposure, they call pellagra, and they cause hyperpigmentation in sun exposure. They call discuss a necklace, dermatitis, B3 deficiency later. Ay, ay, ay. And NAD and ADP reaction, N stand for nicotinamide, which is niacin, and nicotinamide was derived from niacin. Therefore, all the oxidation reaction are niacin dependent. Example, pyruvate to acetylcoenzyme A went from NAD to NADH, and niacin is involved there. Tryptophan can use in synthesizing niacin and serotonin, while it's the essential amino acid, but it's not the main source of niacin, but the good source. Nicotinic acid, least expensive lipid, lowering drug. See the fluorescein associated with it. Supposed to take aspirin with it to remove the fluorescein related to nicotinic acid used in treating familial hyperlipidemia. So it's a drug of choice for elevated hypertriglyceridemia. It's a drug of choice for elevated hypertriglyceridemia. It's not cholesterol. Nicotinic acid, nicotinic least expensive lipid lowering drug. See the fluorescein associated with it. Supposed to take aspirin with it to remove the fluorescein related to nicotinic acid. Used in treating familial hyperlipidemia. It's a drug of choice for elevated hyperglycemia. Hypertriglycemia. Vitamin B3, niacin. So niacin will remain this 3D, which is diarrhea, dermatitis, and dementia. So have a sun exposure area hyperpigmented. So they call the pellagra. So they call the cassis necklace. Also involved with the NAD and ADP reaction. N stand for nicotinamide. So nicotinamide derived from niacin. Therefore, all the oxidation are niacin dependent. Example, pyruvate to acetylcoenzyme A went from NAD to NADH, and niacin is involved here. Tryptophan can use in synthesizing niacin. Tryptophan can use in synthesizing niacin. Tryptophan. Tryptophan can be used in synthesizing niacin serotonin while it's an essential amino acid, but it's not the main source of niacin, but the good source. Nicotinic acid, least expensive lipid lowering drug. See the fluorescein associated with it. Supposed to take aspirin with it to remove the fluorescein related to nicotinic acid. So used in treating familial hyperlipidemia. So this is drug of choice for elevated hypertriglyceridemia. Nicotinic acid is a drug of choice for the familial hyperlipidemia. So if mà flushing, then we use aspirin, remove flushing-related nicotinic acid. So aspirin have that function. Tryptophan involved niacin, serotonin. Serotonin is essential amino not main source niacin, but a good source. Tryptophan in the turkey a lot, right? Anyway, maybe done for now.